Good afternoon, everyone. Today, I am here to represent my topic ankle joint. Ankle joint. Ankle joint, also known as talocrural joint. It consists of a deep socket formed by the lower ends of tibia and fibula, into which the upper part of the body of talus fits. The talus is able to move on transverse axis in a hinge-like manner. The shape of the articulating bones, strength of the ligaments, and the surrounding tendons make this joint strong and stable. Articulation between the lower end of the tibia and the two malleoli and the body of the talus. The inferior transverse tibiofibular ligament, which runs between the lateral malleolus and the posterior border of the lower end of the tibia, deepens the socket into which the body of the talus fits. The articular surfaces are covered with hyaline cartilage. Ankle joint is a type of synovial and hinge joint. Capsule. Capsule is attached proximally and distally to the bones just beyond articular margins, as shown in the picture. Ligaments. Ankle joint is associated with two ligaments. First, medial ligament. Second, lateral ligament. Medial ligament. It is also known as deltoid ligament. It is the stronger of the two. It is attached by its apex to the tip of the medial malleolus. Below it has two places of attachment. The deep fibers are attached to the non-articular area on the body of the talus. The superficial fibers are attached to the medial sides of the talus and the tuberosity of navicular bone. Medial ligament consists of four bands and they form a triangle. First, posterior tibiotalar ligament. Second, anterior tibiotalar ligament. Third, tibiocalcaneal ligament. Fourth, tibionavicular ligament. Now, lateral ligament. It is weaker than the medial ligament. It consists of three bands. First one is anterior tibiofibular ligament. It runs from the lateral malleolus to the lateral surface of the talus. Second, calcaneofibular ligament. It runs from the tip of the lateral malleolus to the lateral surface of calcaneum. Third one, posterior talofibular ligament. It runs from the lateral malleolus to the posterior tubercle of the talus. Now, movement of ankle joint. Ankle joint shows two types of movements, dorsiflexion and plantar flexion. The movement of inversion and eversion of foot seem to occur at ankle, but actually they take place at the tarsal joints. Dorsiflexion. The dorsal surface of foot is fixed. The toes points upward. The muscles responsible for it include are tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Dorsiflexion is limited by the tension of the tendon calcaneus and posterior fibers of the medial ligament and calcaneofibular ligament. Now, plantar flexion. It is the movement of the foot in which its plantar surface is fixed. The toes point downward in this movement. The muscles responsible for plantar flexion include soleus, plantaris, peroneus longus, peroneus brevis, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. From above list of muscles, it is quite clear that more muscle mass is involved in plantar flexion than in dorsiflexion. Plantar flexion is much more powerful. It is limited by tension of opposing muscles, the anterior fibers of medial ligament and the anterior talofibular ligament. Synovial membrane. The ankle joint is surrounded by a synovial membrane that cushions and protects the bone ends that articulate the ankle joint. This membrane provides cushion and lubrication for the joint. It ascends up a small vertical recess between tibia and fibula. Now it's blood and nerve supply. Blood supply. Malleolar branches of anterior and posterior tibial arteries supply it blood. Nerve supply. Branches from tibial nerve, deep peroneal nerve and common peroneal nerve. Ankle sprain is most common. It occurs due to stretching and tearing of the ligaments when plantar fixed foot is excessively inverted. Lateral ligaments is stretched and torn. Anterior talofibular ligament lost commonly torn. When plantar foot is excessively everted, deltoid ligament is not torn, instead medial malleoli, as we can see in the picture. We see three types of sprain. Type 1 sprain, when ligament is only stretched. Type 2 sprain, when ligament torn slightly. And type 3 sprain, when ligament is completely torn. Malleolus. A malleolus is the bony prominence on each side of human ankle. Each leg is supported by two bones, the tibia on the inner side of the leg and the fibula on the outer side of the leg. The medial malleolus is the prominence on the inner side of the ankle, formed by the lower end of the tibia. Second, the lateral malleolus is the prominence on the outer side of the ankle, formed by the lower end of the fibula. Medial malleolus. Medial surface of the lower extremity of tibia is prolonged downward to form strong pyramidal process flattened from without inward the medial malleolus. The major structure that passes anterior to the medial malleolus is the saphenous vein. Medial malleolus is also the attachment of the major ligament on the inner side of the ankle called the deltoid ligament. Lateral malleolus is found on the foot end of the fibula of a pyramid form and somewhat flattened from one side to side. A major structure that is located between lateral malleolus and the Achilles tendon is sural nerve. Now its clinical significance. There are two types of fractures: bimalleolar fracture, trimalleolar fracture. Bimalleolar fracture is a fracture of the ankle that involves the lateral malleolus and the medial malleolus. Trimalleolar fracture is a fracture of the ankle that involves the lateral malleolus, the medial malleolus and the distal posterior aspect of the tibia, which can be termed the posterior malleolus. The trauma is sometimes accompanied by ligament damage and dislocation, as we can see in the figure, bimalleolar and trimalleolar ankle fracture. Thank you.